Thank you for your interest in our study entitled Impact of Disconnected Pancreatic Duct Syndrome on Endoscopic Ultrasound-Guided Drainage of Pancreatic Fluid Collections. My name is Vinay Chandrasekhara, and I'm the senior investigator for this study. This was a single-center retrospective cohort study including consecutive patients who underwent EUS-guided transmural drainage for pancreatic fluid collections secondary to acute pancreatitis over a 5-year period at the Mayo Clinic in Rochester, Minnesota. Out of a total of 206 consecutive patients with pancreatic fluid collections during the study period, 141 met study inclusion criteria. Of these 141 individuals, 57, or 40%, were diagnosed with disconnected pancreatic duct syndrome. The most frequent type of collection was walled-off pancreatic necrosis, which encompassed 55% of the study population, and 20% were noted to have extension of the collection into the pericolic gutter. Patients with DPDS were found to have smaller fluid collections and collections that were more often located around the body of the pancreas compared to those without disconnected pancreatic duct syndrome. DPDS was not associated with lower clinical success or increased need for repeat interventions. Specifically, patients with a disconnected pancreatic duct had a similar need for endoscopic necrosectomy, additional drainage, whether endoscopic or percutaneous, or need for surgical intervention. The time to resolution was also similar between both cohorts. However, when stents were removed in individuals with a disconnected pancreatic duct, there was noted to be an increased risk of collection recurrence, which was 9% in that cohort. However, this represented an odds ratio of 8.0 over those without a disconnected pancreatic duct, at a median of 194 days after drainage. This study is important because it reaffirmed that disconnected pancreatic duct syndrome frequently does occur in patients with pancreatic fluid collections as a result of acute pancreatitis. Although the presence of a disconnected pancreatic duct does not negatively impact successful resolution, it is associated with an increased risk of pancreatic fluid collection recurrence after stent removal, and thus pancreatic duct integrity should be evaluated for determining long-term management strategies to reduce the risk of collection recurrence. Thank you.